Okay, I would like to thank the organizers for this very kind invitation to this interesting topic. Well, my colleague nicely, as usually, presented the arguments for yes, and I will try to change at least some views on that problem. Well, our vision is very complicated and many cells are involved. This slide was maybe not presented before. You see here on the right the photoreceptors, which are CONs, responsible for the color vision, and the rods responsible for the vision in the night. Then we have the layer of the bipolar cells and horizontal cells, and the last one, the ganglion cells, which were mentioned, with the axons, which start to build the optical tract. All these cells and the axons and dendrites build several layers which can be detected by the OCT. And here you have already seen that there are many layers, and especially two points and two regions are of our interest. There's the region of the macula and the optic disc. And among the layers is what was also mentioned, and I would like to underline this, that retinal nerve fiber layer, the layer which is consisted with the axons, non-myelinated axons, is especially of our interest. Why? Because this layer is vulnerable to the axonal damage, and we can measure the thickness and the possible thinning and which existing over time in MS patients. And the measurement of RNFL layer can capture the axonal loss of these axons. And this happens not dependently if optic neuritis was before or not. However, optic neuritis has an influence, of course, and if optic neuritis happens, then the thickness is much more reduced. So it is also, of course, important in evaluating the effect, clinical effect of this phenomenon. This, of course, how it works in practice. You see on the first part the green lines which show you location when the OCT is taken. The second show you the red lines, that they are borders of the RNFL. And the third, when we see the black lines which show us the thickness of the RNFL. The last one, which was also already previously presented, show you that some normal and subabnormal thickness, and here on the with the yellow color is presented the region when the thickness is below normal values, contrary to the other parts of the eye. Of course, we can follow up the measurements over time, and there were some studies which we can compare the values in the beginning of the disease and following years, and there is a constant decrease in the thickness of the layer, and this thickness is more or less in the rate of 2 micrometers per year, and of course is much greater in comparison with the normal aging. When in control patients we also see the diminishing the thickness of the layer, however not much in comparison with MS patients. The question is, and it was also asked, if this marker, is this RNFL fiber thickness could be a marker of the whole brain volume. And some studies tell us that it could be such a marker, and here you see what you have not been presented maybe before, that there is a correlation with so-called B-coded ratio. B-coded ratio is a ratio which is determined by dividing the distance between two caudets and the distance between two outermost parts of the left and right hemisphere. So this was the correlation which tell us that RNFL fiber thickness could be such a marker, and is, as you know, very easy to obtain, and could be, of course, the method how to easily look at the processes going on in MS patients. Also, what was not maybe mentioned before, and is also important, I think, information, that there is a relation between macular RNFL and the intracranial volume, especially gray matter volume in MS patients, as well as the correlation between ganglion cell layer and inner plexiform layer. These combined two layers also correlate significantly with the brain volume. As you see here, patients with MS, all the results, all the values are much smaller introduced in comparison with healthy subjects. So this is information which we have, and to make you some idea why we must be cautious, because my position is that of course it is a variable tool. I'm not against it, of course, but we must be cautious, and we must consider some limits or some limitations. First of all, RFL thinning exists only in part of MS patient population. Some studies say that not, of course, in every patient. So the percentage of this phenomenon is not 100%, it's maybe 30–40%. This is the first thing. Another thing which was also presented in the beginning, in the introduction, that OCT measurements also are affected by non-MS ocular conditions like glaucoma, like cataracts, high myopia, aging, of course, and so on, and must be, of course, also considered. So it must be, if it is done, it must be taken into account. Another thing which was not mentioned, that there are consensus criteria for retinal OCT, and they are not very easy. They are complex. There are many these criteria which must be followed, and of course, it's everything good if it is a good person who know how to do it, specialized in this technique. But you can do also errors, and so there are, the reliability depends on, of course, the exact following the procedures, and it is the real life. And the last thing is, well, the matter of discussion, if OCT measurements influence or not therapeutic decisions. We heard that it should be, well, somehow taken into account if we start the treatment or not, but I think that there are many other markers which force us to start let's say, the steroid treatment, not waiting for OCT measurements. And the question what was in the beginning, which I want to remind you, the question for that topic is optical coherence tomography essential tool in following up MS patients? I can agree that there is a good tool and we can use in follow-up MS patients definitely, but I don't think personally, and I think you can agree, that this is not an essential tool. It's one of tools we can use in monitoring MS patients, of course, especially taken into account the complex pathology of MS, including the inflammation, the myelination, and neurodegeneration. So this is my position. Thank you very much.